Hello, my name is Heather Hirsch, and I am an environmental health specialist from the Arkansas Department of Health. I am excited to be here today to speak with you all, the future pediatricians of America, about exposures and injuries children often encounter or are at risk for. I know you all want to become pediatricians later in life, so I hope I can give you some good insight into your future patient population. We will begin with an overview of my presentation for today. We will discuss the public health burden of exposures and injuries in terms of deaths, economic impact, and injuries. We will discuss children as a special population. The meat of this presentation is an introduction to common pediatric exposures, including indoor and outdoor hazards and common pediatric injuries. We will briefly touch on the pediatrician's role in prevention of harm from environmental exposures and injuries. According to the World Health Organization, 1.7 million children in the world under 5 years old die from environmental-related exposures. So worldwide, the top causes of death in children under age 5 are related to air pollution, secondhand smoke, unsafe water, lack of sanitation, and inappropriate hygiene. In the U.S., we have less concern for unsafe water, improper sanitation, and hygiene, but we have a large burden of asthma. Air pollution and environmental tobacco have been attributed to the higher prevalence of pediatric asthma and asthma exacerbations in the U.S. In 2010, 7 million children had asthma and 9 died every day from asthma-related illnesses. As the CDC graphic points out, secondhand smoke that impacts millions of children in the U.S. can lead to asthma exacerbations. And then the economic burden of medical conditions and problems that can occur from pediatric environmental exposures to smoke, air pollution, lead, and more have cost the U.S. almost $77 billion in 1 year alone. Looking at the public health burden of injuries, we see that more people die from preventable injuries than any other cause in their first half of life. The economic burden is $671 billion in 2013 from the total cost of injuries and violence in the United States. This information is gathered from the CDC, which also shows that from ages 1 through 44, the leading cause of death in all age groups was unintentional injury. Next, we will look at what makes kids so special. As we all may realize, children are not just miniature adults. They are a special population that requires their own field of medicine, termed pediatrics. Children are still growing, not just in height, but they are also developing their physical bodies, their internal organs, their brains, and their immune system. Because they are not fully developed, they do not have the immune system or the body's defense mechanisms that adults do. For example, because their bodies are developing, they have different mechanisms of absorption, distribution, metabolism, and elimination. This is important when it comes to environmental hazards, contaminants, toxins, etc. It can take less time or a smaller dose of a toxin to have a larger effect on a child. They can also have worse side effects from a toxin or a more serious illness due to the exposure of a contagious illness. They are more vulnerable in children. Also, children consume more water and food than adults, so they are exposed to those sources of potential hazards more than an adult. Children breathe more air, drink more water, and eat more food per pound of body weight than adults. An infant's breathing rate is more than twice that of an adult's, so they're more at risk for inhalation injuries and exposures. This graphic just shows the comparison of a baby's kidney to an adult kidney. There's an obvious difference in size, but most importantly that's related to the size is the function of the kidney. A baby is obviously not going to be able to process a toxin as well as an adult would, especially because of their size and their function. In addition to the biological factors that make kids a special population, we also have to look at the psychological and social factors. Behaviors are an important thing to think about, especially when it comes to a developing child. A young child is crawling and practicing increased hand-to-mouth ingestion. This makes them vulnerable to greater exposures by certain contaminants within specific environments. They may eat dirt or household dust or anything that seems appealing to their eyes. This could be dangerous, depending on what is in the dirt or other hazards. Children are curious, and this could lead them to encountering dangerous household products such as cleaning supplies or medicine. They could also mess with tools and equipment, causing injuries. Also, there are increased instances of accidental gun injuries in the pediatric population because a gun was not properly stored or a child got a hold of it, causing serious harm or injury to themselves or others. As a child is older and begins to take care of their own hygiene, they may not do a great job of allowing themselves to wash their hands or bodies or brush their teeth as often as they should. This could lead to infections or teeth decay depending on the extent or the lack of hygiene. Lastly, social factors have a large tie-in to what we have already discussed. Young children who have vulnerable immune systems can easily spread or catch illnesses amongst each other at daycares and schools. Older children and adolescents can easily spread diseases or encounter the same hazards when they are in sports teams or other large groups. The additional factor of peer pressure can lead children and adolescents to pursue risky behaviors that can lead to injuries. For example, teenagers can be persuaded to do drugs or drink alcohol or inhale or drink hazardous chemicals or even to do risky pranks. These can all have bad outcomes. A child's brain is developing, so they are more open to suggestion and have less capabilities to avoid temptation and peer pressures than adults. This makes them a more at-risk population. It is important to remember that pediatricians treat children from newborns up to young adulthood. Some patients choose to leave their pediatrician at age 18, while some continue to 21. The diverse range in age is important to remember when treating patients. A 5-year-old and a newborn may not be exposed to the same hazards, or they may not react to the same hazard at all the same way. Also, a young child, say 5 years old again, won't have to worry about the same kind of injuries that occur with newborns. And then a 16-year-old, such as the one pictured in our graphic here, could have completely different metabolism rates. It could be more similar to an adult rather than a child. So it's important to remember this diverse patient population when we're treating pediatric children of any age. As we have mentioned briefly earlier, children are at a higher risk of developing adverse reactions to different environmental exposures. Common exposures can be broken into two categories: indoor hazards and outdoor hazards. Indoor hazards can include those found in residential homes, such as lead, radon, pesticides, and tobacco smoke. Lead is probably the most well-known indoor hazard children face. In 2010, more than 530,000 U.S. children had a higher than acceptable lead blood level. Lead can be found in old homes through old paint chips, dust, soil, or even water pipes. Lead can have serious developmental consequences for children, including lowered intelligence, reading, and learning disabilities, impaired hearing, reduced attention span, hyperactivity, delayed puberty, and reduced postnatal growth. Radon is the leading exposure of ionizing radiation, which in chronic exposure can lead to health problems such as cancer. Also, mold and building supplies, including the chemicals in those supplies, can have problems for children. Their curious minds may lead them to playing with or ingesting these hazards, or these indoor hazards could be in the air and inhaled. Each of these can have serious outcomes for children. Bleach is an important cleaning supply that can lead to inhalation or ingestion burns of bodily tissues or internal organs and potentially even death. These indoor hazards are going to affect children from lower income families and certain ethnic and racial groups at a higher level. Almost every indoor hazard affects these children from lower income homes more so than other children. This could be due to the fact that the homes that the lower income children are living in may not have been safely vetted for lead, radon, mold, etc. Also, there are other psychological and social factors that could go into this. This graphic summarizes some of the indoor and outdoor hazards we discussed. We think that keeping ourselves inside our homes will keep us safe, but there are so many hazards that can affect adults and especially children that we just can't see. Looking at outdoor hazards are things like air pollution, which we stated earlier can lead to asthma. It can also inhibit lung development in children. Allergens like animal hair, dander, pollen, etc. can lead to sinus irritations and infections. Playgrounds can be an important source of germs. Some of the equipment may contain chemicals, which could be dangerous to children. Also, playgrounds can be a source of childhood injuries. This graphic we want to specifically focus on the child here and how there's a relationship with asthma and air pollution. So, as we started to briefly mention the injuries, we'll talk about common pediatric injuries. Unintentional injuries are the #1 leading cause of death in all age groups of ages 1 through 44 in the U.S., according to the CDC, as we mentioned earlier. Of those, the most common unintentional death is from unintentional motor vehicle accidents. Although children are not the cause of the accidents, due to their vulnerable and growing status, they are at risk for serious injury. Also, drowning is high on the list, especially in younger children or children that do not know how to swim, or they may be swimming in dangerous conditions. And if we think just about infancy, before 12 months, babies are at risk for unintentional suffocation that can be caused by unsafe sleep environments such as co-sleeping, not using a proper sleep surface such as a crib, or other factors. Also, infants may be shaken too hard due to excessive crying or whatnot, and this may cause traumatic brain injuries and death. As we've talked about exposures, children are at risk for unintentional poisoning, such as that from the bleach or other cleaning supplies. Other causes of injuries not thought about widely is due to unsafe firearm storage, when children can get a hold of firearms and hurt themselves or others, as we discussed earlier. Another common injury that can range from little problems to serious health issues is that of helmet use. Traumatic brain injuries can result when there's a bad fall off a motorcycle, skateboard, and more. These cyclist injuries are not commonly thought to cause death unless they lead to the traumatic brain injuries, but they are an important source of morbidity. This graphic from the CDC is just going into more detail on the specific injury deaths that are being caused in the unintentional injury death categories. Under age 1, we talked about the unintentional suffocation that can be caused by unsafe sleep environments, so co-sleeping or sleeping with items in the crib that could potentially cover the face and lead to suffocation. And then when they're a little bit older, drowning becomes more important. And then from kids from 5 up all the way up until 24, the #1 cause is the unintentional motor vehicle accidents. And this could be largely related to biological factors such as size and how a child may be at higher risk for injury in a traumatic crash, or maybe not using their seat belts or car seats correctly, which could lead to more serious injuries. Also, when you're a little bit older, from maybe the 14 to 24 age, we could have bad driving skills, which could lead to unsafe risk, and that could lead to harm. That's all I wanted to kind of show from this graph. I know it's a little busy, but I think it gives us a good idea of what's most important. So now we will discuss a little bit about the role of physicians in the pediatric environmental health. So we know that proper housing is extremely crucial in environmental health of children. Children living without a home or in an unhealthy home environment are at an increased risk for negative health consequences. So it's an important role of the pediatrician to biomonitor through developmental ages. This just means that the physician should be aware of any environmental exposures or injuries that may have occurred and to be on the lookout for different changes such as developmental delays that can occur from lead exposure and those signs and symptoms, and to be aware of those and to combat those either with treatment or interventions. As the CDC states, only 1 in 15 physicians have trained on environmental exposures, and then less than half of those have taken an environmental health history. And from this presentation, I've discussed the roles and importance of environmental exposures and injuries, especially in the pediatric population. So this is just alarming to me that so few physicians incorporate this into their practice. I really hope from this presentation you have learned how important these topics are for kids and how we can have a role and protect them and to provide a better future for them, because we know of all the health consequences that can occur. In summary, I hope that you have learned some things about the pediatric population and how special they are. Children are not just miniature adults. They have different exposures and injuries that they are at risk for, and that these are common and serious. There's a public health and economic burden in the terms of billions of dollars that are associated with these hazards and exposures and injuries. And pediatricians have an important role in preventing childhood injuries and harm related to environmental exposures and potential injuries that they may incur. Also, there's a need for better environmental health training for physicians, and I hope that I've given you a little insight into that today, and that you'll be able to take this with you into your future practices. Here are some of the references that I used for this presentation. A lot of things came from the World Health Organization or the CDC, and there's a few papers as well. Here's a second set of references that I've used, also from the CDC or the EPA as well. And if you have any questions, feel free to let me know. I'm here to answer your questions and to hopefully gauge your interest. I hope that I've given you some good information and that you will take this with you guys. Okay, thank you.